LSU Health Shreveport recently held a reception honoring new appointments to the administration's leadership team.
This just represents some of the recent appointments that I've been able to make. And I think it's important for those of us that work here on a daily basis to know who your leadership is and know that your leadership is here to support you. I think it's also important to recognize these folks that are assuming these positions.
This endeavor to reinvigorate, reinvent, and move forward to a new day of research requires all of us. And as Dr. Dali just mentioned a moment ago, we've had some pretty impressive statistics just in the 13 or 14 months that we've been at this. Our institution is up 28% in federal extramural grant funding. That's a very significant increase. So much so that our colleagues down south are paying attention to this as well. We've also really begun to advance our technology and our commercialization efforts here at LSU. Whether you know it or not, our campus is number 2 in the LSU system, only behind the Agricultural Center in Baton Rouge and the amount of royalties that have come into the institution. So we really are a golden egg. And on top of that, the number of patents that we've had issued continues to go up. So really, I think our best days are ahead of us for research. It's a great opportunity. It's a great time for us to come together as a team and really advance research.
It has been a great experience the last 2 years. I think we've made a lot of changes with Dr. Dali's help, with Dr. Fox's help, with other people in this room. We have a long way to go. We're going to have to transform this medical school and this medical center into a modern entity, one that's not dependent upon state funding, where I don't have to worry about what's going on in Baton Rouge today or tomorrow or another day. That day is actually upon us, and we have to change the way that we're doing things. We still have to keep our core values at heart. I see Jane Eggerstedt standing over here. In education, we're all here for that. That's the reason why we're here. We're here for that research. We're here to take care of the patients that deserve our best possible that we can give them, regardless of whether they can pay us or not. That's the reason why we're here. And I thank you very much for the opportunity to be able to serve you. Thank you.
I'm highly Catholic, so I'll probably thank a bunch of people because I get guilt if I don't. So I want to thank the executive team, Janine and Dr. Lewis and Dr. Townsend, who really literally put in thousands of hours making sure that the documents are just right, that the clinical care is just right, that everybody is getting what they need, and we're progressing the way we should be. I'd like to thank the group from the FGP. As you may or may not know, we started the FGP about 18 months ago. Tremendous undertaking. I think the good news is, because of all this work, when we met with Ochsner, I think Dave and I met with them 4 or 5 months ago, they were thrilled to hear that we had started talking the RVU language and all the other things that go into clinical accountability. I want to thank my department. It seems like I always have a meeting. They always find a way to get me out. They never say you can't go. I don't know why, but they never say that. I'd like to thank, obviously, my wife and kids who have helped put me here today. So, thank you very much. And as always, I have an open door policy, so if you need anything, just come see me.
All 3 of these gentlemen today have made significant accomplishments in their respective areas, and that's why we're here today. They're making everyone's life easier around this health science center.